Welcome to H&HN Daily. I'm Susanna Hopsollen, Senior Editor for Hospitals and Health Networks magazine. Effective adoption of information technology is critical for the transformation of healthcare and delivering greater value to patients. Today, I'm joined by Russ Branzell, CEO and President of CHIME, to discuss top IT priorities for rural hospital CEOs. CHIME is the professional organization for chief information officers and other senior healthcare IT leaders. Welcome, Russ. Thanks for joining us today.
Thank you very much for having me.
Russ, we're here at the Rural Leadership Conference. What's on the minds of CEOs and trustees in terms of IT strategy and challenges they face?
Right now, I think the thing they're really trying to grapple with is just the overall magnitude of what needs to happen in their organizations. There's so many competing activities right now for the resources they have, and they're just trying to figure out how to balance all of that. There are so many initiatives that are IT enabled or driven, and they just can't do them all. So they're trying to figure out how to prioritize all this work that needs to get done in a very short period of time.
What should be top on their priority list for 2014?
Well, there's definitely some strategic imperatives that need to occur in 2014. Obviously, ICD-10 is right at the forefront of that. That date doesn't appear to be slipping again. It does not appear to be slipping. So, and that has to happen on October 1st, 2014. And right at the same time, we're supposed to be doing Meaningful Use Stage 2. While we're optimizing Stage 1, all that workload that needs to occur, along with many other smaller activities, but really aren't smaller, such as security, big data, analytics, population health, ACOs, all these things are converging at the exact same time in a perfect storm of work.
What are some of the concerns regarding security of patient information?
Well, I think right now across the entire country, this is a relatively new focus area for most organizations, in particular for CIOs. We've generally not had chief security officers on our staffs. I didn't have one in my previous organization until the very end of my tenure there. And most organizations today don't have one. So true industrial strength security doesn't exist in most healthcare organizations. And they don't want to be the next one on the main page of whatever magazine it might be that they've had a vulnerability and a risk or a breach occur. But more importantly, we owe it to our patients and the people that we serve to appropriately secure and protect their information, just like any other information that they've been entrusted with.
How does IT strategy help with physician alignment?
Well, I think right now, especially with the convergence of physicians into an employed model in most hospitals and health systems, well over 50% now, I think it's really critical to make sure that the IT portion of this is in parallel with or in sync with the overall organizational strategy. And if you look at this now from an electronic information flow, we need to bring them into one common medical record. We need to bring them in one environment for patient sharing of information and really enable them to be the catalyst for appropriate patient care and patient change that needs to occur.
How does IT governance keep you on track?
Well, right now, I think in many organizations, people are still just trying to put IT in as fast as they can for meaningful use and other reasons. And governance is really the process that should be putting that in check. A very well-run organization with good IT governance will really put the business and clinical needs first prior to even making an IT decision. And what that really means is, in the end, the business and clinical leaders need to own the process outcomes and all the work that needs to occur to actually appropriately implement that IT solution and get the benefits they all deserve.
What advice do you have for hospital CEOs on how to engage the patient through IT?
I think right now this is truly one of the things that's an imperative for us. And if you look at that versus the commercialization versus consumerization that's occurring really across all industries, not just healthcare, and that is to make it very unique for their experiences, to bring them and be part of the care process. There's those traditional models of having patient panels in hospitals and engaging them in that. But more importantly, how do we engage them where they're at? Everyone owns a smartphone now, everyone has an iPad or a tablet, and everyone's involved in electronic media. How do we engage them where they're at rather than have them, what we traditionally did, have them engage us where we are? We need to bring all those solutions to where they are.
Thanks for joining us today.
Thank you.